This is Dennis McMahon, and welcome to Positively Vermont. And today we have with us the Commissioner of the Department of Disabilities, Aging, and Independent Living, and the Deputy Commissioner. And we're going to discuss a very interesting uh, program, plus also an honor that our entire state has recently received. So, would you kindly introduce yourselves?
Yes, thank you. And we're positively pleased to be on air with you today. I'm Dr. Jill Bowen. I am the Commissioner for the Department of Disabilities, Aging, and Independent Living, which we refer to as DALE. And with me is
I'm Angela Smith-Dieng. I'm the Deputy Commissioner here at Dale.
That's great. Yeah, I'm glad you said Dale because I kept thinking it's Dial or something like that. But now we got all that straight. Once we get the nomenclature straight and the
we're
title
good.
straight, we're fine. We can talk forever. But tell us, number one, what your agency does.
So you can hear in the name of the agency that there is a focus for people of all ages and all situations in terms of any form of disability. So we have a large focus on people with developmental or intellectual disabilities. We have a focus on people with movement disabilities, blind or visually impaired, hearing or hearing loss. We have just a whole range of focus on disabilities. And of course, the age span. Also, aging is a major focus for us. That's older Vermonters. And of course, when you focus on older Vermonters, it's going to run the gamut of all sorts of um, challenges and strengths and many things to celebrate and many policies and programs that are advantageous for older Vermonters. And then our department also has a focus um, on vocational rehabilitation through higher ability and through the Division for Blind and Visually Impaired. And we're also the survey group for the licensure of our healthcare system. So that's just a sprinkling. Did I miss anything significant?
No, I would just add that so our overall mission is to make Vermont the best place to grow old or live with a disability with dignity, respect, and independence. So across all of those programs and services, that's our goal.
And I would add that we are part of the Agency for Human Services, and we work very, very closely with our sister and brother agencies.
That's great. Well, thank you for that, Cap. And I'm one of the people you serve. I'm a senior citizen, and I want to really focus on the start about this honor or recognition that the United Health Foundation found that Vermont is the number one place in the country for the health and well-being of older adults. Tell us about that.
Well, first of all, I want to say we are very excited that Vermont is recognized as number one in the nation. Last year, we were actually number three, and we celebrated that a little bit too, but it's nice to have continued to move up those ranks and to be number one in the country is a big testament to the people of Vermont, the older Vermonters, because when you look at what were the contributors to that success in health, you're really looking at a very active population who are engaged in the outdoors, who are exercising or enjoying nature. So there are things that the older Vermonters do, including really strong volunteering and a significant percentage of the workforce that does contribute in terms of physical activity. There's also lower tobacco use than in many states. Our air and water quality is very good. We have just a number of factors to what makes Vermont Vermont that contributes to healthy aging.
And what about the speaking of health, what about the susceptibility to certain illnesses and some of the trends you see in the country where lung disease and cancer and other illnesses? How do we stand in terms of those factors if they're part of it?
So we have our share of illnesses and challenges too, of course, across the board, in fact, but in the older Vermont community, we do have fewer kinds of chronic conditions, partly due to some of those environmental factors, but we certainly do see quite a bit of complexity in the challenges that our older population experience. We do know that falls is a significant problem, in part because people are out and about a lot, and there are weather conditions that also contribute, but falls is a challenge in our state, as is mental health challenges. Thinking of suicide is still a factor for Vermonters' older population. And so it's not that there isn't a lot of work to do and a lot of challenges. You know, we have a certain percentage who are facing housing insecurity or poverty or just financial insecurity. We do have very good programs to mitigate any kind of food insecurity, our Meals on Wheels. And I must say that our older Vermonters are the absolute backbone of the volunteer group that go out and deliver meals for folks who otherwise might be hungry, and also the social engagement that comes when people do go out and deliver those meals is very, very important.
We're in the post-COVID era now. Could you tell us how COVID impacted and the recovery from COVID, how that impacted?
So some folks who were more isolated than they had been before COVID didn't get back out into the communities. In fact, communities as a whole are still healing from COVID. And so the social interaction piece is something that we watch very, very carefully. And of course, some of the places where people would congregate during COVID was not as safe during COVID to do that congregation. So some have not returned back, but I have to say our home and community-based services are very active and some of the best in the country. So there is a lot of effort and work around creating that kind of infrastructure.
Yeah, I'll just add too that, you know, one thing that we look at too is how important prevention is. And one of the things that happened during COVID, right, is people put off a lot of those preventative healthcare services, like their cancer screening or you know, other things like that. And so one of the things that, you know, one of the areas where we see room for improvement in the measures in the report is really around getting to people earlier for some of those prevention efforts. Certainly, we want to have a robust set of services when people with high needs need that, but we also want to be reaching older Vermonters early on and making sure we can keep people as healthy as possible for as long as possible.
And we want to make sure we have the ability to help folks get to screenings and prevention and checkups. And for some people, they may not have a car, they might not have access to any form of public transportation. So we look very closely at that. Given our awareness of the challenges, I'm going to turn it to Deputy Commissioner Angela, because there is some incredible work going on here. And I can say that because I'm here a little over a year now, and this work was really going on in a very collaborative cross-sector way called Age Strong Vermont. And she's going to tell you a lot about this effort. We're in year 2 of a 10-year plan, and this is pretty incredible. So
That's
I'm going to turn
great.
this to
By all
describe
means,
it.
let's hear about Age Strong Vermont.
Yeah, happy to talk about Age Strong Vermont anytime. It's our state's multi-sector plan on aging. And that's really a key piece, is that it's multi-sector. So it's not just about services for older adults, but it's about housing and transportation and community design, affordability, social connection. It's about caregivers and really strengthening all the systems of support that we have to support aging well in Vermont. So Vermont was the fifth country, or the fifth state in the nation, to create a multi-sector plan on aging. And it's a 10-year visionary plan. It has 7 large goal areas like affordability, healthy aging, etc. And then it has over 30 objectives and over 160 strategies. The effort to bring this plan to fruition really began with the passage of the Older Vermonters Act in 2020, which really laid the foundation for this work. And then Dale, in partnership with the Department of Health, really worked to bring together organizations and key leaders from across organizations, working with older Vermonters in a variety of ways, to do a really significant needs assessment, to understand like what's working well in Vermont right now, what's helping Vermonters to age well, and what are the challenges for Vermonters. So we did surveys and listening sessions and focus groups and just gathered a great amount of data to inform the development of the plan. And then worked across agencies and across organizations to put this plan together. It's really comprehensive. It's really broad because it recognizes that we have to work together if we want to support aging well. There's no one agency or organization that can do it all. That it's really, if we want to see older Vermonters healthy and well in 10 years, we all have to be working together now. And so that means thinking about things like transportation and housing, in addition to supports and services. It's been a really amazing effort, and great to see more and more partners come to the table and want to be part of making Age Strong Vermont a reality.
So we did complete year 1 of implementation and have a report. If you'd like it, we can send that to you. It summarizes what we accomplished in year 1. We're in year 2 now. I have to say, having awareness of the scope and breadth of this plan was an enticement for me to come to Vermont to work in this department. And I am sure it is a contributor to our being selected as #1 in the country. It is an excellent report. And keep in mind all of the objectives and goals and strategies that Angela is talking about really cut across those factors that are part of the senior report state rankings, which are social and economic factors, physical environment, clinical care, behaviors, and health outcomes.
Well, I know you're dealing with a multi-group of agencies and professions, but maybe you could comment on the role of the medical community in our state in all of this.
So we work very closely as a system, right? So Dale is the state entity, and so we partner with quite a few providers who are specialties in different areas across the range of the people that we serve. And so it's hundreds of providers in the community, as well as the hospital systems, as well as the long-term care systems like the nursing home systems or residential care homes. It's quite an array of options and services that range across the public health sort of triangle, right? So you have some low-level in the community supports that maybe are a few hours a week that people may either come to a senior center or get some services in their home, all the way up to intensive care, whether that's at a hospital or a nursing home, and everything in between.
That's wonderful. What
You want
about
to
the,
talk about innovative, like housing, like shared housing?
Oh, yeah.
yeah,
So one of the things that comes out in the America's Health Ranking Senior Report is one of the areas that Vermont is challenged with is housing, and we all know that, I think. But one of the areas in H Strong Vermont that we're focused on is housing, and specifically really trying to ensure that older Vermonters have housing options. So if people want to remain in their own home and what's called aging in place, that we provide the resources for people to be able to do that. If they want to downsize into senior living of some kind, that we have options for people to be able to do that. So some of the things that we're excited about is the expansion of home share as an option for people. Home share is a great program where an older Vermonter who has space in their home can be matched with someone who needs housing, and there's a robust kind of interview process to make sure it's the right match for living together, but that can provide social connection, financial support, and really is a win-win for everybody. So we're excited that Home Share Vermont is slowly expanding to more parts of the state, offering that option in more parts of the state. We've also been working with the Vermont Center for Independent Living to be able to offer more support for home modifications and assistive technology. So people who want to age in place but need a ramp or need more grab bars in their bathroom or need an accessible kitchen, they can have those modifications done to their home to be able to stay where they want to be, if that's their choice. So those types of things can be barriers on the individual level, but working together, we can provide more options for people.
that's great. What we like to do here on Positively Vermont, and a lot of the agencies you mentioned, we have had shows with them, Home Share and food services. And well, what do you need? What do you need from the legislature or the federal government and the public? How can people help to can make a
So
contribution to this?
we work really closely with our legislative partners. We work closely with the federal government. We have resources that flow in lots of different ways. But we do have the H Strong Vermont plan because we have goals. And to reach those goals, you need several things. You need sufficient resources for scaling up the things that are most effective and the things that people most want. You also need collaboration and coordination. And so working with partners is absolutely essential. That's actually going quite well, but you need to integrate. You also need to communicate because you'd be surprised how many people still don't know about what their options are or how to make those connections. So I've been to every corner of the state doing listening tour, but also finding out that there's lots of gaps in what people know or how to go about it. And then depending on, to some degree, geography, there's real challenges in different parts of the state depending on how rural it is, or each community has its own challenges. So there's lots of work to be done, and it cannot be done, which I know Angela alluded to, without integrating and partners. And that's partners across AHS agencies, partners across the state, different agencies. It's partners in the community, the home and community-based services providers. It's the hospital system, it's the nursing home system, and it's the legislature.
What about the private sector? What role does that play?
Well, I mean, the private sector also serves Vermonters. So, when we think about capacity and we think about what people need across the board, we think of it as in total, because we are viewing it from the state platform, right? So it's all the Vermonters we are looking for this to be the best place. to grow old or to live with a disability.
Right. And the private sector, businesses within a community are part of a community, right? Serving older Vermonters as well. And so one of the things that we try to encourage at the local level is for each community to say, how can we make this community more age friendly? Right. So that could be, your local bank or credit union, how to be a place where older Vermonters, especially those with different challenges, whether it's mobility challenges or cognitive challenges, can come and feel welcome. So creating age-friendly spaces um, in our businesses, in restaurants, there are ways to make age-friendly menus more accessible, for example, and the way that you talk with older adults as a waitress or waiter. So there's so many different ways that I think local communities, businesses, partners, government, et cetera, can really be working to bring to life the goals in the Age Strong Vermont plan.
And just to highlight, it's really important that we get support from everyone on the ground in terms of things like ageism, right? So we are working to flip that script, right? Because if you think about the contributions of our older Vermonters, whether it's the workforce, the volunteer force, the community engagement, family support, it's tremendous. And so ageism is still a stigma, across the country, probably across the world to some extent, right? So here in Vermont, we need everybody to really think about that consciously and to work to dispel it.
Well, that's great. Now, where can people get in touch with you or find out more information about your programs and what you offer? You can give us your website or
Okay,
whatever.
so there is a website. Obviously, we have a website for Dale, or the Department of Aging and Independent Living. But Angela's going to describe a really good service finder that's available on there, so that if people want to know about programs in their area, they
That's
can
great.
go on that site. Yeah.
Yeah, so we as part of our year one of Age Strong Vermont and really trying to support social connection, we created a map, the social connection map, where people can find in the, look regionally or look locally and find the, where's the senior center, the library, the town hall, the adult day center, the memory cafe, or the area agency on aging, among many other things. So that social connection map, you can get to it from our website, dale.vermont.gov. Or you can also get to it from the Age Strong Vermont website, which is actually at healthvermont.gov/AgeStrongVT. So there's multiple ways to get to it, but if you just Google Vermont Social Connection Map, you can also find it that way.
So one of the things, but I don't want to let go of this before we just get this out, but not everybody in Vermont is connected, digitally, to be able to just go onto a computer and Google, right? And some, have varying interest in it, or, training or experience with it. So we also know that sometimes people just want to pick up a phone and ask a question. The area agencies on aging are the resources for all things aging, and there's one in each region. And that we can send you that. It's also he can look it up on the website.
Yeah, but they have a 1-800 number that
Right.
works anywhere, wherever you are in Vermont, you can call 1-800-642-5119. And that will take you to your local area agency on aging. And they can help with all kinds of questions that people might have.
Right. So you don't have to be computer savvy to get some help and support and answers to your questions.
Well, that's great. Now, we're going to certainly follow you and your agency, and perhaps we'll have you back in the near future to deal with various aspects or other pieces of information for the public or how people can help. And I want to thank you for appearing on Positively Vermont. My guests have been Commissioner Jill Bowen of the Department of Disabilities, Aging and Independent Living, and the Deputy Commissioner of that department, Angela Smith-Dieng. Thank you very much, and thank you for watching Positively Vermont.